what defines us as human beings on a cognitive level. Our brains can remarkably create mental constructs beyond the tangible world, but it also makes us suffer from unreal dangers. How is it possible for someone to be intelligent and educated, yet still make grave errors, such as believing in conspiracy theories or joining cults? Why do we tend to follow imaginary prohibitions and create harmful ideologies instead of choosing freedom? The phenomenon of dissociation is the key to the process. It is a protective mechanism that activates in case of aggression. Thanks to him, the victim escapes the pain of what they are currently experiencing. A dissociated mind numbs itself, even to the extent of reversing its perception of reality. Dissociation occurs because consciousness functions as a mechanism for association. Good mental health involves the ability to simultaneously connect two identical and appropriate perceptions of reality. Dissociation isn't always a survival tactic. In the absence of a traumatic context, it can be intentionally triggered by someone seeking a hallucinogenic reward.
Don't be too compliant. You should be more spontaneous. Trust no one.
Conflicting instructions can unsettle those who hear them, leading to reduced cognitive performance. Since these messages can't be linked together, they create a stunning effect that disrupts one's sense of reality. In mammals, sex is distinctly binary. Our brains are naturally equipped to immediately distinguish between a man and a woman. The discourse surrounding trans identity is rife with astonishing contradictions that clash with our perception of reality.
Hold on, those outdated sexist attitudes. I'm not a man.
Mister.
You are not a man.
No. I don't know what makes you say that I am a man, but I am not a man.
Your appearance.
All right? It's important not to mix up gender identity with gender expression, or we'll be starting off on the wrong foot. So explain to me. I'm non-binary, which means I'm neither male nor female, and I don't want to be labeled as a man.
How would you describe yourself?
As non-binary.
As non-binary?
Sure.
All right, but neither masculine nor feminine.
Exactly.
This doesn't solve the problem of women on the set.
This doesn't address the issue of women on the set, but please don't say there are 4 men on the set, as it's misgendering and quite unpleasant.
A trans-identified person is a portable generator of cognitive distortions. This phenomenon numbs the perception of reality and creates strong hallucinogenic effects.
I'm finally becoming the person I should have been from birth. So this label of being a trans woman, honestly, it's a bit bothersome because it suggests that I wouldn't be a real woman, that I wouldn't be a woman. Yes, it's true that there are some elements missing to be completely a real woman, but still, in terms of gender identity, I have been a girl since the day I was born. I realized it around the age of 4 or 5. So for me, I am a woman and that's that.
These dissociative messages influence the brain like a drug. Addictive, they allow someone to take control of a person's mind and make them do anything. Someone who feels disconnected from themselves may believe they're a spirit born into the wrong body. Detached from their physical self, they may be easily convinced to undergo extensive medical and surgical procedures, including gender reassignment, to make their appearance match this transcendent spirit. In Western countries, the number of young people identifying as transgender is steadily increasing, driven by strong social influences, heightened by social media addiction and 2 years of global lockdowns. Young girls who wish to become men are now the majority, whereas they were non-existent 10 years ago. The transgender phenomenon is growing, with its followers becoming younger and younger.
Coming out as transgender.
Dysphoria.
Testosterone shot.
Someone who is transgender.
Low transgender identity.
From FTM person.
What's going on in your underwear?
Testosterone. transition I took, a testosterone blockage.
A woman born in the body of a man.
The initial phase of gender reassignment involves taking hormones of the opposite sex. The effects of testosterone can vary greatly from one woman to another, but they can sometimes be quite remarkable. After 4 to 6 months of testosterone treatment, women's voices become irreversibly more masculine.
All my life I felt uncomfortable in my female body. I never felt like I belonged.
I'm really happy actually. With each injection I feel like I'm getting closer to myself.
So, emotions are really something that has changed within me. People make fewer mistakes about me in the street.
I have more breasts, so right now I'm wearing a bolero for extra care and support. It's been about 10 months, a little more, give or take a few days. I'm truly moved by the journey I've been able to make.
Their scalp hair may thin, while facial and body hair growth increases. If genetics predispose someone, baldness can occur. The skin may become rough, oily, and prone to acne.
What's going on, everybody? It's your boy Aiden here, and the theme of what just happened for the last 4 minutes of me trying to get my image very clear and perfect.
Testosterone redistributes fat in women and enhances their muscle tone, giving them a more masculine appearance. However, testosterone does not affect height. Trans men will remain significantly shorter than the average man. The external part of the clitoris can grow from a few millimeters to a few centimeters.
Some changes that are permanent include
the breast, vagina, and uterus shrink. Menstruation ceases. The vaginal and uterine mucous membranes become delicate and brittle, potentially causing severe side effects like tissue death and blood poisoning. Long-term use of hormones from the opposite sex is harmful to the reproductive organs. It causes temporary infertility, which may become permanent over time. Given the high risk of cancer, it is advised to remove the ovaries and uterus after 5 years of testosterone use. However, in practice, a hysterectomy often happens much sooner due to unbearable pain.
I decided to go to the Family Planning Center in Grenoble, mainly because I wanted to avoid seeing a psychiatrist and an endocrinologist. They are accustomed to welcoming transgender people, so it's quite safe and comfortable for them to visit. Hey everyone, hope you're all doing well. So it's off to the hysterectomy procedure now. We're all set to go. I'm settling in because I'm quite content this way.
Finally, we talked a bit about my upcoming surgeries and such. I told her that I really wanted to have a hysterectomy, especially considering the intense pain I'm experiencing right now. When I have them, I writhe in pain and it's unbearable. I can't stay like this anymore. She told me, if you want, I will do it myself. I am quite accustomed to performing this operation. In fact, I carry it out almost every day, so if you would like, I can certainly do it for you. So I said yes, absolutely. The initial 2 to 3 days following the surgery were quite challenging mentally. I was feeling a bit of the blues for a while. I was heading back home. It wasn't the same atmosphere as the hospital. Maybe that's why I had an anxiety attack, but it was the first time I experienced such a severe one.
I took testosterone. I've been on testosterone for 8 years. I am a boy, and your term just verified that. I am a transgender man, and a valid one. Fucking figure it out. You guys don't know what you're talking about. You don't get it, do you?
Is testosterone what makes you a man? Is testosterone what makes you a man?
Me saying I'm a man makes me a man. And whatever hormones I take makes me feel happy and confident. I would have killed myself without testosterone. Because I wasn't fucking happy. Because I didn't want to be a woman. I am a man. A transgendered man, and I'm valid. And I have a fucking pussy.
The symptoms of mental illness vary depending on the culture and the era, which means mental illness is heavily influenced by the cultural environment. And so, a few years ago, there were many anorexic girls. Nowadays, there are many anorexic boys, and the girls who were anorexic 30 years ago are now the ones distancing themselves from this condition. And so why? Because social influence, especially via social media, significantly determines the symptoms. Essentially, there is an underlying discomfort. And this discomfort manifests through different symptoms based on the individual, their family environment, and their cultural background. Therefore, the symptom itself is not important. The root cause of the discomfort needs to be addressed. In psychiatry, that's how it happens.
Animals live their lives searching for food, building shelters, attracting mates, reproducing, and raising their young, much like we do. The key difference is that humans are the only animals without predators anymore.
For me, every transgender person I know has felt certain about being trans from a very young age. Trans people never question.
In men, estrogens lead to a decrease in libido, a reduction in the size of the penis and testicles, and muscle loss. The chest enlarges and fat distribution becomes more feminine. However, estrogens have a significantly less feminizing effect on men's bodies compared to how testosterone masculinizes women's bodies. To compensate, they resort heavily to cosmetic surgery.
Thursday, I do my hormone injection under the skin. You see, that sucks. I hate when I have to do it.
Clairement, j'ai des hanches. Vous pouvez le sentir, j'ai une taille beaucoup plus fine par rapport à mes hanches qui se sont développées. J'ai des cuisses très féminines. Maintenant, je trouve vraiment, genre, tout s'est féminisé. J'ai des cuisses assez féminines. Je prends au niveau des cuisses, des hanches et des fesses.
These drugs are being used in the setting of profound scientific ignorance. You can't reassign sex, right? It's impossible. No one is born in the wrong body. It is essentially a cosmetic intervention for some root psychic distress, some psychological distress.
Trans influencers and gender clinics often suggest that giving hormones of the opposite sex can transform the body from one sex to another. They overlook the fact that the nucleus of each of our cells contains a male or female karyotype, XY or XX. Our DNA is sexed. Each cell behaves in a sex-specific manner, regardless of hormonal influence. Under testosterone, female cells don't respond like male cells. They react in a distinct way. Similarly, for male cells saturated with estrogens, administering opposite sex hormones affects more than just the genitals and overall appearance. It sets off chain reactions in the liver, heart, arteries, bone density, brain, and throughout the entire body.
It should be no surprise that if you take a male hormone and put it into female physiology at excess levels, that bad things are going to happen. So a woman taking testosterone has 4 times the odds of developing a heart attack than a woman who is not. It's twice the risk of the male rate. So men taking estrogen will develop blood clots and strokes at 2 to 3 times the rate of men not taking estrogen and women.
Men on estrogens face a 2 to 3 times higher risk of developing thrombosis and heart attacks. Weight gain is common. The risk of breast cancer increases with age, and more notably, the risk of brain cancer rises significantly over time. Androcure is a testosterone inhibitor. This medication is associated with an increased risk of suicide among transgender women and the development of brain cancers. With Androcure, the risk of developing meningioma is 7 times higher for those on high doses over a short period. After 5 years of treatment, it is multiplied by 20.
Donc maintenant, je vais préparer la zone.
Women on testosterone experience a rise in red blood cells, increased cholesterol, gallbladder issues, weight gain, and elevated liver enzymes. Testosterone also contributes to the onset of type 2 diabetes and a 300% increase in cardiovascular risks, including hypertension, blood clots, and heart attacks.
The issue lies in the lack of scientific foundation and therapeutic evidence to apply these treatments. In any case, in all cases, these are symptomatic treatments. Now, when you are with a patient, the first thing you want to do as a doctor is to cure them, to provide a therapeutic treatment that will heal them, a curative treatment. This is precisely why I disagree with referring to it as conversion therapy, especially when the goal is to help the patient reconcile with their birth sex. Helping a patient reconcile with their birth sex is a curative treatment. When we cannot offer a patient a curative treatment, we must resign ourselves to providing symptomatic treatment. In the case of sexual reassignment therapies, the symptomatic treatment involved is very intense and completely irreversible, which means we need extremely convincing and robust scientific evidence before we can proceed with this kind of symptomatic treatment. Because a symptomatic treatment will not cure or remove the cause of the discomfort, Generally, when we treat a patient symptomatically, the patient continues to feel unwell. We are only removing the symptom. Removing the symptom with such a heavy treatment is enormous, obviously, as the patient continues to feel unwell.
Animals build shelters, use tools, and can solve relatively complex problems. Humans are the only animals capable of creating abstract mental objects, disconnected from sensory experience, and treating them as if they were real.
How are the terms man and woman and boy and girl defined?
Well, that's a great question. So I did an undergrad and a master's in gender studies, and I don't know if I could even tell you that, right? Because part of it is you cannot get away from social constructionism and language, right?
A binder is an accessory that helps flatten the chest to create the appearance of a flat torso. It's mainly used by transmasculine individuals like myself because it gives us a flatter chest and makes it easier to be perceived as male. I understand it's not always easy, but please try your best to follow the safety guidelines as they are crucial for your health. You shouldn't wear a binder for more than 8 hours straight. Whenever you can, like when you get home, take it off. Even if you come home for lunch for just half an hour or an hour, take it off. It costs nothing, lets you breathe a bit, and you can put on your pajama top for an hour. It won't hurt. Most importantly, don't sleep with it on or exercise while wearing it. If you don't follow these safety guidelines properly, over time you may experience issues such as breathing problems and/or back pain.
In the early 20th century, women's liberation was marked by the abandonment of corsets, which restricted breathing and movement. Today, transgender individuals advocate for binders, a new type of corset used to flatten the chest before surgical removal. These binders can alter the shape of the breasts and may lead to back issues, tissue damage, muscle strain, and respiratory problems, and in some cases, even rib fractures.
I'm gonna grab right here, under your armpit, and lay it down like that while the tape is still slack, right? And then while it's slack with no tension, just smooth it out.
I didn't specifically want to go to the most expensive and well-known surgeon in the trans community because I feel that he takes advantage of the high demand for his services by raising his prices significantly.
I didn't talk about the importance of the hold as part of the effort. This certainly is work that I very much believe in, but it's also work that everybody, all the cisgender folk, really talk about.
After undergoing breast removal, transgender men can share images of their bare chests on social media. Sadly, a significant number find themselves treated by inexperienced surgeons drawn to the lucrative nature of this field. Many lose their nipples and experience a true butchery.
We will not let fear win. A world without trans people has never existed. A world without drag has never existed, and it never will. Queer people have always been here amongst us.
I see myself as a woman.
In essence, I'm a woman.
I'm a transgender person, which means...
So it's been exactly a year since I underwent my vaginoplasty.
I became very interested in transgender identity.
I've watched numerous videos about FTM individuals as well as MTF individuals.
Another video on transgender identity, obviously, because honestly, that's all I know how to do, and anyway, that's the only reason you're here. At the start of my transition, I began taking testosterone blockers, which completely eliminated my libido.
Encouraged by the unclear messages from sex reassignment clinics, many young transgender individuals are convinced that changing one's sex is truly possible. They envision having a custom-made functional penis or vagina, much like selecting a car with various features.
We meet for my vaginoplasty. It's not the big day. My surgery is set for December 7th.
Today, I'll be discussing phalloplasty and metoidioplasty. More specifically, knowing how to make a choice when hesitating between the two.
The reality is that no surgery can create a male sex organ on a female body, or vice versa. These new organs are merely inadequate, non-functional substitutes, achieved at the cost of destroying the biological sex. Testosterone enlarges the external clitoris from millimeters to centimeters, causing significant discomfort and reduced sensitivity.
Here's your pair of pants, here's nothing, and then all of a sudden, boom, and it's rubbing against your pants and underwear all day, just walking around back and forth. It's painful. It's not like sensitive in the fun way. No, it's like any type of touch is not fun.
Metoidioplasty involves cutting the ligament connecting the labia minora to extend the clitoris, creating a micropenis of 5 to 6 centimeters that lacks erectile function and will retract after a few months. Phalloplasty is the procedure that most closely matches the stereotypical male sexual ideal, aiming to create a large penis. To achieve this, surgeons take skin, fat, veins, and nerves from a forearm, which leads to a large scar and significant permanent functional loss in the donor arm and hand.
This is just a video of the first time that I saw my arm after surgery, and Dr. Kind was changing my dressing and kind of giving me instructions on what to do with it.
All right, you hold it right there.
Professor Desgrands-Champs begins the dissection of the vagina.
This is the vaginal wall we're gradually removing. We gently go deeper in contact with the vagina. The beginning is a bit difficult to find the plan, then it becomes more and more liberated. We remove the vagina because it is a mucous membrane that continues to secrete. Even if we closed it, it would still secrete. This can lead to cysts and infections later on. Therefore, it is necessary for us to remove all of the living viable mucous membrane.
Gradually and meticulously, Professor Desgrands-Champs stitches the labia minora together to create the urethral canal. Meanwhile, Dr. Binder has fully detached the flap. He has removed all the skin and fat from 3/4 of the forearm down to the muscle.
There, he is completely free. This is the underside of the flap, so it stays attached here by the vessels at the base, which we'll leave for now to shape it. We'll cut them at the end when everything is finished.
Be ready. At the bottom, the penis can now be carefully shaped to the desired form. First, the surgeon carefully stitches the initial part of the flap around a tube, which will be used to create the urethral canal.
The skin is rolled onto itself to form a fatty roll into which a tube and a pump are inserted to simulate an erection. Residual hair in the urethra often causes complications, infections, and necrosis. Repairing the forearm usually requires a skin graft from the thigh. These surgeries are performed after a hysterectomy. To lower the risk of necrosis and cancer, the vaginal mucosa is removed and the vaginal canal is sealed. The clitoris may be buried in the fatty tube, but it is often removed, leaving only the nerve intact. Therefore, phalloplasty includes the removal of the clitoris. Mac McClellan, a journalist suffering from psychiatric disorders, staged a mock scenario of her own rape, claiming it was to heal from post-traumatic stress. Later, she appears on the cover of The New Yorker, stating, "I needed a penis to truly be myself." It's not surprising that phalloplasty often results in a reduction or even complete loss of sexual sensations, a fact that even trans activists reluctantly acknowledge.
There is a little bit of give and take when it comes to this surgery. It's like not, it's a little bit dulled, or a lot bit dulled compared to what it was before. You know, pre-surgery, it's like sensation is great, it's amazing, that sort of thing. Post-op, it's great, but it's dulled. But I feel like there's a little bit of a balance of sacrifice. So if you're someone who, let's say, okay, for me, for example, sensation is great, insecurity, not so great, getting off, not so great. So it kind of balances it out, where now I'm aligned, things are, you know, connecting with my brain, I don't feel as self-conscious, therefore, to me, like, the sensation sacrifice is worth it, and it balances out, because, you know, when you feel really self-conscious about something, it's not so great feeling. So think about it. This is something to consider when you are going into the surgery. If sensation is really important to you, and you're not super insecure about things, then maybe don't go for phalloplasty. Maybe metodioplasty is something that would be more preferable for you, or maybe nothing at all. It's all your decision. There's tons of things to weigh your pro and cons list about. I was definitely more set on being able to stand to pee and size and aesthetic overall, so that's kind of basically why I went the route I did. And I think that although sensation is not as good as it was pre-surgery, like it balances out for me. So that could be you too, could be not, I don't know.
Connecting nerves in this delicate, complex area causes common and expected post-operative complications. These include fistulas, pain, anorgasmia, loss of sensitivity and function in the dominant arm and hand, urinary incontinence, repeated infections requiring large doses of antibiotics, necrosis of the neophallus, and for some, stomatotomy.
We now have children's hospitals all over Europe, halting and banning all childhood medical transition.
Before transitioning, Scott Nugent was a lesbian mother of 3. A disastrous phalloplasty led him to the brink of death. After narrowly surviving septicemia, she is now actively campaigning against sex reassignment treatments.
How can kids see around the corners when you parents have no idea what medical transitioning is? When I was told that I would live, I decided to sue the surgeon. The experimental procedure, he used 6 inches of hair and put it on the inside of my urethra. For 17 months, I had infection after infection after infection. I have an arm that I can't use. He charged me over $257,000 for this surgery. I have over $900,000 in complications from this surgery. Yeah. I spent 17 months on a bathroom floor, crying, not sleeping. I mean, it was horrible. Horrible. And I remember, call it God, whatever you want. I remember sitting on that bathroom floor and I said, if you allow me to live and be here for my kids, I guarantee you, I will be here for other kids. So this has nothing to do with religion. This has to do with we are tearing apart our children and we are scared of the bigotry word. Well, jump in my shoes for a second. This needs to stop. Yeah. This needs to stop.
Hey everyone, today we're back with an exciting new video for you all. Hi, it's been a really long time since I got up and I'm so happy about it. I got up this morning and I didn't bleed at all. Usually, I urinate blood and that means I have to go back for surgery. There, it's not bleeding heavily at all. It was really tough. I feel like I ran the marathon of my life. I just went from there to over there. I really hope I get out and everything goes well afterward and that it heals as quickly as possible so I can finally rest, because I swear to you, it was the hardest experience of my life. Yeah, seriously, there's really nothing harder than this. It was really very hot.
The trans influencer Cressida has, to her dismay, become the face of this butchery, heavily promoted on her website, which showcases the trans industry. Her phalloplasty led to 5 emergency surgeries to fix a repeatedly rupturing urethra. Damage to the donor site on her forearm required a skin graft from her thigh, high doses of painkillers, and multiple sessions in a hyperbaric chamber to aid healing. 42 days of hospitalization to urinate standing up. Phalloplasties often lead to severe post-operative complications, affecting nearly 70% of cases. Despite this, the demands continue to grow. Sex reassignment services report waiting times of up to 7 years for phalloplasty. In the natural world, males have to compete with one another for the chance to reproduce. These contests, which are rarely fatal, help establish a hierarchy. Only the champions can attract females provided that they desire it. The status of the victors is unpredictable and constantly under scrutiny.
But I even got abused in my doctor's waiting room. My doctor's response was, well, you chose to do this, so you're going to have to get used to it. Which, first of all, shows he knows nothing about being trans, because you certainly don't choose it. And secondly, that he had no empathy as a human being. And then my partner got pregnant. And the plan was that our child would have 2 mothers from the day they were born, which back in 2000 was unheard of, especially if one of them was trans.
You're going to give me my fucking money back.
Excuse me, sir. There's a young man in here. You need to watch him.
Excuse me, it's ma'am. It is ma'am.
I can call the police if you'd like me to. You need to settle down.
You need to settle down and mind your business, okay? Ma'am, once again, ma'am.
I said both of you.
No, you said sir. Once again, it's ma'am.
I actually said both of you guys. It was just general.
Right beforehand, you fucking said sir.
Sir? Okay.
Motherfucker, take it outside. If you want to call me sir again, I will show you a fucking sir.
In human society during the era of patriarchy, all males, even the weakest, assume they have the right to reproduce without needing to prove their worth through competition. Many don't hesitate to use force against females to coerce them into mating. Some even pretend to be females to reach their objectives.
Suggestion seems to be that a man, a sexually predatory man, would dress as a woman with the sole intention to gain access to a women's
If you
refuge.
were a predatory man, why wouldn't you actually try to do that?
But I think that's a preposterous suggestion.
Is it, though?
Is it? I can't.
We've already had male rapists identifying as women to try and get into female prisons. A, for an easier time, and B, because then they're surrounded by women. Yeah, it's happened.
Well, they identify as female in prison, but they are transgender prisoners. We're not suggesting that they're men.
Captivated by the transgender phenomenon, the media persistently promotes an alluring vision, that of a transhuman man, to the extent of embodying the absolute ideal of the female sexual stereotype. The formation of a neovagina represents the final phase in this extensive surgical journey, the ultimate commitment to fully transition to the other side of the mirror. Trans activist groups work hard to portray vaginoplasty as a straightforward surgical procedure with minimal side effects. Experts in sex reassignment assert that they can transform male genitalia into appealing and functional female organs that are sensitive and capable of providing satisfying sexual sensations.
Bottom surgery is a nice surgery in that we tend to get very good results when it comes to sexual function. And indeed, in the literature, when we look at satisfaction scores, patients, once all is said and done, oftentimes tend to have very high satisfaction scores after bottom surgery, after they healed. So we're seeing about 90% of male to female bottom surgery patients have good scores when it comes to sexual satisfaction.
However, I'm having a hard time experiencing orgasms like I used to, but I believe it will happen eventually. It's really a different practice this time, so things need to be approached differently. I haven't experienced an orgasm yet, but I'll be sure to keep you updated if I manage to make it work as I hope.
The creation of a neovaginal cavity is achieved through penile inversion, which involves cutting and turning the penis inside out to form an artificial cavity. A section of intestine is used to create the wall of the neovagina. Some adventurous surgeons use tilapia fish skin or a vagina sourced from a cadaver for the procedure. Unlike a natural vagina, the resulting cavity lacks elasticity and does not self-lubricate. The glans is connected to the base of the penis to mimic the external part of the clitoris. On the other hand, the deeper internal structures of the clitoris, which are involved in female vaginal pleasure, do not exist. Since the neovagina is made from anal mucosa, it tends to emit persistent, unpleasant odors. Hair from the penile skin often grows inside, which can lead to infections and tissue death. The body perceives this artificial cavity as a wound and will continually attempt to close it.
And there, during the second dilation, my vaginal cavity prolapsed. You should know that this is something that never happens. Basically, it only happened to 4 people out of 100 operations with my surgeon, and it absolutely had to happen to me. So now I have to go back to the operating room for another surgery, and unfortunately, I will have to spend another week in the hospital. Honestly, it's starting to really frustrate me. I admit I'm reaching my limit, but well, it's great. I anticipated that the vaginoplasty would be mentally challenging, but to this extent, absolutely not. I never imagined it would be this difficult.
Gender reassignment surgery, known as vaginoplasty, is a procedure aimed at achieving physical conformity. Let's be clear, a neovagina does not change one's sex, it is about conforming to the physical appearance and characteristics of the opposite sex. Sensations, especially orgasm, are often experienced through fantasy for many individuals. It is important to note that there is simply no such thing as a vaginal orgasm. This is because it remains a cavity that we created within the spongy body of the male penis, which is covered or at the very least lined with skin, is definitely not a mucous membrane. The sensations you feel are truly zero.
The maintenance of a neovagina compels transgender women to use dilators daily to prevent it from closing.
Ow. Ow, what? No. Oh, God, Lord. Alexa, tell me a joke.
The second complication was a kind of vaginismus, if I may say so. My dilator today, I believe this is the case for many women who don't necessarily talk about it openly, but my dilator in fact doesn't go in completely easily. That is to say, it takes me a good half hour to settle in completely. These aren't biological vaginal walls either. They may not have that elasticity yet. My pelvic floor, if you will, really blocks it, so that's why it takes some time. After about 5 to 10 minutes, I can really manage to insert it. And that's why I'm seeing a physical therapist who really tells me how to do it. The depth isn't easily accessible, it takes time. In fact, if you will, in interactions, the guy isn't going to wait, so it needs to be fairly smooth. And the fourth thing is that now, if there's a hormone shortage at the pharmacy, I become depressed. No, I mean that I don't have any. So we're a bit dependent on hormones. I'd like to live without a pump because now I don't have testicles anymore, which means I might not have enough testosterone, but I still have my urinary glands, so maybe I can live without hormones. I don't know, it's to be tested. I wouldn't take the risk, but there you go. So there is still something that rebalances externally and not internally, which is to consider. That bothers me a bit.
Regarding the pain, whether it's the pain I mentioned before, I really don't have any more pain related to that, whether it's pain from my scars or pain during intercourse. Listen, I'm not going to share my sex life with you, but when it comes to intercourse, just be careful, stay calm, and everything will be fine. If you stress out like me, it won't go well. Really, if you have concerns about this, don't worry, it's completely normal. You shouldn't stress or put pressure on yourself. But just so you know, I did have some complications along the way, because I'm always honest with you and want to keep you informed. I experienced some normal complications, not like, wow, this is badly done complications. It's just that, nothing more. It is too tight and too brief. And I know that I'm someone who gets really stressed about life, so there were times when I even ended up whining right after. Not whining out of pain, but more like it didn't work.
Beyond the myth of sex change, the reality is a significant lack of sexual activity and the lifelong need to care for a wound that the body persistently tries to close, often through painful dilations.
The folks that I see who are fortunate enough to have had no pelvic floor issues prior to surgery or after, the biggest thing I see is they're not able to have an orgasm when they want to, or it's not as strong as they would like. They're not able to use their anatomy for pleasure. And is the need for dilation still as important?
Yeah, definitely. Lifelong dilation is pretty much the rule. We've seen patients coming back even 20 plus years out from a vaginoplasty that have something happen in their life that they just don't dilate and are having sex for a year, and they will lose a lot of depth. Doesn't tend to be a width issue so much, but definitely will lose a lot of depth. So we do kind of say, you know, lifelong dilation if you want to maintain as much depth as possible.
I never thought I would have such a hard time recovering. I thought, you know, I have so much people supporting me. I've never had any problems before. I'm going to be okay. I'm going to wake up from the surgery and recover normally like everyone else. But that did not happen. I had the toughest time at recovering ever. I was in so much pain to the point where I had to question myself. And for a moment, I asked myself, what am I doing to myself? Why am I going through this? Did I make a mistake? And at that point, I was regretting my surgery because of how badly I was in pain. And I don't think anyone will understand what I went through, except my roommate. I'm 21. I flew over to Montreal by myself and had this major surgery done. I'm not sitting here complaining to you guys. I know a lot of people would love the surgery, but I'm just telling you guys the truth. When it comes down to it, people make it sound so easy, but it is so hard. I lost so much blood that I thought I was going to die. I was in the recovery home and I cried every single night, calling my boyfriend and calling everyone I knew that I loved, because I thought I was going to die.
But let me be very clear, it's torture. Imagine dilating while not being healed, because that's what you'll be doing. You'll be dilating wounds that will gradually heal, sometimes reopening, and this may also cause what's known as hypergranulation or excessive healing, which can result in gaping wounds that will need to be treated with silver nitrate. It's a form of violence both in the act itself and in the physical sensation, because it involves a lot of pain. You're creating a cavity to convince yourself, oh well, I'm like a woman, I have a vagina. But to me, a neovagina is more like a wound or a gaping wound. There's no point, no. We always come back to the same thing. It's about conformity, especially since there's no pleasure involved.
Penile inversion surgery turns men into eunuchs, making them dependent on medical care for life. For most of them, sexuality after surgery is non-existent, a result that was highly predictable.
Almost none of the vaginoplasty patients that I see have any desire to utilize the canal for penetrative intercourse, either because they're just more comfortable, going rectally, or they, I have a lot of patients with vaginoplasty who only have partners with vulvas, and it's just penetrative intercourse has just never been really on the table. And now whether that's due to the difficulty of what you mentioned with erogenous stimulation post-op.
It is like you say, like it's the minority of people that are actually using their vaginal canals. I think a lot of people do need to have a vaginal canal to feel complete for themselves and to, have their dysphoria adequately relieved. But I think there are a lot of people over the years that have just gotten a vaginoplasty because that was what was available to them. And I would much rather do a vulvoplasty and have a small chance someone will want a vaginal canal in the future and do a slightly more complicated surgery than having the more common thing of a person that isn't really wanting the canal and doesn't use it and isn't doing a good job dilating, and then all of a sudden is having these pelvic floor issues and chronic discharge and infections, and it just becomes a huge mess. So I think it's better to just avoid those things unless they truly need them. And I would feel much better about a conversion canal than trying to take away a canal, which is very hard to do. Yeah, so that's kind of my personal opinion, I guess.
For a trans person, having sexual relations in this way doesn't feel natural. There's pain in the seat area. Our pelvic zone ultimately isn't adapted for this. It's something that was created. This entire pelvic area, along with the muscles that support it, are also prone to experiencing pain during penetration. This discomfort occurs because these parts of our body weren't originally designed for this purpose. Nature didn't give us this body to make love in this particular way. And finally, there is internal pain. The neovagina remains a cavity. I will outline. It's the bottom of a cave. At some point in time, your partner's penis or even the use of dilators will inevitably hit the wall of this cave. For a woman, not only does it dilate, but it also contracts on its own and adapts to the shape of the penis naturally. For a trans woman, it's not the same. There's also the psychological aspect to consider. Living with this body, which is, let's say, still altered, means you have to cope with it for the rest of your life. This surgery is definitely something to think about and reflect on deeply. I can understand that many people regret it, and I actually have many friends who might not have done it.
The reason why I got SRS, sex reassignment surgery, was because of major gender dysphoria. When I was little, I hated seeing a penis attached to my body. I did not like it. Believe it or not, when I was young, I took a pair of scissors, stood in front of a mirror, and almost snipped off my penis. And that way the doctors would have to give me a vagina. All right? Now that I have a vagina, obviously I would love to use it, but I didn't know that I would not like it. It does not feel right. It does not feel good. It's painful. I don't know if I got botched inside, but for the few times I did have sex, I bled so much. I didn't like it. I've tried. I'm not being, oh my God, it hurts, I'm a wuss. No. Like, it actually hurts so bad. I can take a huge ass cock in my ass, no problem. But with the vagina, it's different. And you know what? I'm okay with that. I'm okay with not having penetrative sex in my vagina because I do much rather prefer it in the back door as a boy and as a girl. There's a reason why I don't dilate. I don't enjoy it. It doesn't feel right. It hurts. It truly, truly is so painful. There are so many women out there who have vaginas and they don't use it. And you know what? That's okay. Just because I had the sex change surgery doesn't mean I have to use it. I'm just glad my penis isn't there. That's all I have to say.
This approach to making love is something we are still getting used to. But even as we gradually become more accustomed to it, it doesn't feel completely natural. I experience this almost every day with my partner. See, it's quite complex, really very complex indeed. And it's not just physical, but also mental. And this particular mental aspect has the potential to precisely reactivate this pubertal and sexual dysphoria, bringing those feelings back to the surface. In any case, this feeling that I have experienced since childhood, since adolescence, because I place it at the age of 9, so these acts can quite simply turn into suicidal thoughts. After surgery and a journey of 9 years, with a certain level of fulfillment, I'm not saying that I manage to live every day, but people see me as someone who doesn't carry the trans label. On the contrary, I don't advertise it. I find fulfillment in my relationship, society, and professionally. However, the transition didn't turn me into a woman. I remain a trans feminine man, someone who embraced feminine stereotypes to try to feel better, but the discomfort remains, even if slightly lessened.
Several studies report similar results. 81% of trans women who have had vaginoplasty suffer from chronic pain years after the surgery. Over half report experiencing painful sexual activity. A third of them are incontinent.
It's been a complete hell. My life has just went down the hill ever since I had so-called bottom surgery trying to be a woman. I wish I could go back and not have any surgeries or medical transition or take any hormones. To be honest, like, this transition has costed me so much of my health, both mental and physical, as certain relationships in my family.
Professionals in the trans industry justify these destructive operations by the risk of suicide. The reality is that suicide attempts increase by 20% post-transition. Once the operation is completed, patients are left to themselves. The transgender community tends to dismiss those who bring negative news, especially when their experiences challenge the idealized view of gender transition. Unfortunately, some people, like Savannah Meadows in Canada and Nathan Verhelst in Belgium, have sought assisted suicide to end their lives.
I don't care if this is a rant. I'm beyond frustrated and mad with the system, with the so-called healthcare system. I'm not seeking gender-affirming care. I'm seeking medical care. I'm seeking answers as to why I'm experiencing pain when I dilate and pressure. It's very uncomfortable, and yet I'm supposed to settle for numbing cream. These maid assessors are such a joke. It had to take me to seek medical assistance in dying in order to be taken seriously.
Regarding the group, first, we have a very specific case of someone who, after surgery, had made an appointment in Switzerland directly for euthanasia. So in the end, the surgery didn't resolve anything. I have a friend in Alsace who, she herself, tried to commit suicide. I haven't had any suicide attempts after the journey I went through. On the other hand, the thoughts remain too regular for me to say that ultimately, was it necessary? My question today is, did I really need this surgery? Ultimately, from a diagnostic perspective, was this surgery necessary to remove these thoughts? Today, I find it hard to know. Psychologically, I'm still affected. And so this impact creates thoughts of ending it all, quite simply. And so this also questions the surgery and sometimes the overall process. Perhaps there is another way to ultimately undergo a medical and surgical transition to specifically alleviate this pubertal and ultimately suicidal dysphoria.
In the natural world, males must exercise patience. They employ intricate strategies to attract females for a chance at reproduction.
There's no right way to be a woman, okay? Let's just go ahead and break that binary. Some women have facial hair. Some women shave their armpits, some don't. Some men have vaginas. Some women have penises. Get over it.
In the human species, some males disguise themselves as females to gain privileged access to young children and engage in sexual relations with sexually immature beings.
Why was it so important to call you by the name Stella?
Because ever since I was a boy, I felt uncomfortable in this body, and it was absolutely necessary for me to return to being who I was really.
A girl, a little girl, and you've known this since you were 3.
The transgender identity tsunami is engulfing increasingly younger children. Experts in the transgender industry aim to create individuals who appear more convincingly as the opposite sex by avoiding the puberty of their biological sex. In recent years, sex reassignment treatments have been preceded by the use of puberty blockers. These blockers are given to kids as young as 11 and sometimes even at 8 or 9 years old for those who have socially transitioned very early.
What is normal? What is normal? It's 2022. No one knows what normal is at this point.
Puberty blockers lead to the suppression of ovarian and testicular functions. For this reason, the same molecules are administered to men suffering from prostate cancer. They are used cautiously in adult cancer patients due to their well-known devastating side effects. These are the same compounds used for the chemical castration of sex offenders. For several years, everywhere in the world, puberty blockers have been used on children who are very pubescent, without market approval or any comparative studies to measure their long-term effects. Professionals in sex reassignment describe puberty blockers as a way to pause puberty in children who identify as transgender, allowing them time to explore their identity and decide whether to continue transitioning or return to their biological sex. Parents are informed that these effects are physically harmless and completely reversible.
What actually ends up happening is when they're that young, usually it'll end up being just hormone blockers, which are completely reversible. Completely reversible if they decide that's not what they want. But the thing is that actually going through puberty is so traumatic for some of these kids. It made me so detached from my body. And I can't undo that. I can't undo that. I can't undo the puberty that my body went through naturally. What do we want? Trans rights! When do we want them? Now!
I do not like spending my free time asking adults to make good choices. God made me. God loves me for who I am, and God does not make mistakes.
Before the rise of transgender children, puberty blockers were used to delay puberty in shorter children, hoping to help them grow taller. If used briefly, puberty resumes normally once treatment stops. Unfortunately, in the US, over 10,000 reports have shown severe side effects and extreme bone fragility leading to vertebral compressions and replacements of hips, femurs and jaws. Victims of these risky treatments may find themselves at 25 with a skeleton akin to a 90-year-old, which can crumble or even fall apart. Moreover, it is important to distinguish between children of small stature who will resume normal sexual development after the pause and trans-identified children who proceed from puberty blockers to taking opposite-sex hormones.
They're making these young people believe that you can change your sex when in reality it's not possible to change your sex. You can simply transform a body in such a way that it closely or distantly resembles a body of the opposite sex. However, when individuals come and suggest to very young children, specifically those in early elementary school, such as first or second grade, that they should contemplate whether they feel comfortable in their assigned sex, and if they do not, they will be given the option to change their sex. That is a blatant lie. These children still believe in Santa Claus, so when you tell them if you're a girl, you can become a boy and vice versa, they believe it. This is an abuse of power by adults over children. These children not only believe you, but they also have no understanding of the consequences of what will happen to them as a result. It's overwhelming and unbearable to hear this kind of talk directed at children.
In May 2021, Sweden's Karolinska University Hospital decided to stop giving puberty blockers to dysphoric children due to severe side effects. Out of 440 children who received hormone treatment at Karolinska Hospital, 13 of them suffered extremely serious bodily harm, leading some to suicide.
My advice is just be yourself and don't let anybody tell you who you are.
Osteoporosis, a bone disease typically seen in the elderly due to hormonal deficiency, has been reported in recurring testimonies among 15-year-olds on puberty blockers. The concept of gender ideology inevitably clashes with reality. Puberty affects more than just sex and reproduction. It triggers a series of changes throughout the body, beginning with the growth of bones in the brain.
It's very expensive. It's so expensive, $1,000 a shot.
I just am letting her be who she is.
No blood? Do you feel the burn, Maxie?
Research indicates that puberty blockers can have lasting effects on the intelligence and memory of children and teenagers, with their IQ dropping by an average of 7 to 8 points compared to a control group. This isn't surprising, knowing that by blocking the hormonal impregnation of the body, these molecules put a stop to brain development. Several studies have linked puberty blockers to a statistically significant increase in suicidal thoughts and self-harming behaviors, especially among girls. There's a higher risk of anxiety, depression, and sleep disorders, and sometimes even the development of psychotic symptoms in previously mentally healthy individuals.
I am still on HRT. I am not detransitioning or anything. Just my gender is a complete nightmare. I don't know what's going on with it right now.
Hi, this is Dr. Christie. I just want to give a brief public service announcement. I feel a responsibility as a physician to be honest about puberty blockers and hormonal therapy in teenagers. This can lead to infertility, and I don't know if that's really well known. That means that you would never be able to have your own children. It really is important to go through puberty at your normal sex, as your normal sex, and at your normal rate, and not arrest that process. Give your body time to complete the process before you start changing things that could have long-term implications. So I want you to be smart about it. That's what I'm here for. Help you out.
In the natural world, mothers tirelessly strive to safeguard their offspring. They ensure their survival until the young are capable of taking care of themselves, teaching them how to hunt and defend against predators. In the 21st century, human mothers are disturbingly proud to mutilate their children and let sexual predators educate them.
To kids, I think, drag queens are princesses come to life or superheroes. Kids, they're imaginative, they're all about play. They haven't been baked into,
Oh my God, I'm so excited. I want to share something with you guys that I've never told you guys before. I've always wanted to be able to lactate. And today, my doctor, after my EKG results, said that she's feeling confident enough to start me on this medication, Reglan. and it has some serious side effects, but I'm only going to be taking it for 2 weeks, up to 3 weeks possible. So within 2 weeks, I should be lactating. The rest is on me.
As the trend of supporting trans children leads to earlier transitions, professionals in sex reassignment are quietly acknowledging a concerning issue. Children who undergo puberty blockers and cross-sex hormones face sexual immaturity, which hinders their transition. This is partly because there isn't sufficient human tissue for the surgery, and also because without experiencing puberty, nerve endings do not develop properly.
I would say that I have a girl brain and boy body, and I think like a girl, but I just have a boy body, and it's different than you.
The American reality TV series I Am Jazz showcases the transition of Jazz Jennings, who did not conform to gender stereotypes. The everyday life of Jazz and her parents provides phenomenal publicity for the sex reassignment industry to millions of viewers.
One day, she came up to me and she says to me, "Mommy, will you do my hair for me? Can you make it into 2 ponytails?" And I made like these 2 Pippi Longstocking ponytails. She was so cute, and she just looked at me and she says, "Mommy, I love you, and I love my hair." And every time I say that, I just never forget her looking up at me, and she was so happy. And I got it. I was like, okay, I'm gonna do whatever it takes to make you happy.
Despite the millions and glamour, this trans icon's path is far from rosy. Jazz faces ongoing obesity issues due to hormone treatments that affect his sense of fullness. He also experiences bouts of depression.
At the beginning of high school, I did go through an emotional depression. I have depression myself.
Like all children on puberty blockers, Jazz will remain sexually immature throughout their life, which has compromised their sexual development. To construct a faux vagina, the skin, tissue, and nerve endings from an adult penis are required, which is not feasible with a child's penis. In one episode of the series, Jazz undergoes a complex vaginoplasty, necessitating multiple corrective surgeries. These are performed by Marcy Bowers, a renowned transgender surgeon specializing in vaginoplasties. After 3 consecutive surgeries, Jazz realizes the unavoidable truth. He will never be able to experience orgasm.
I feel like I've already lost the aesthetics, you know. Hopefully after this revision, it'll look good once it heals. But if I lose some of my sensation and nerve endings, I might never experience an orgasm.
I guess it's goodbye time.
As a specialty, you know, we've maybe done a handful of pubertally suppressed adolescents as a field, and no one's published on it yet. We're just putting our first series together as we're kind of learning and figuring out what works. But it's really changing things because you don't have enough tissue to line the vaginal canal. So you either have to take a skin graft or take skin from elsewhere or use some artificial product. The way that we're dealing with it is by using a robot, and we're basically performing intra-abdominal components of the surgery. So we're using peritoneum, which is the inner lining of the abdomen, to line most of the vaginal canal. And by doing that, that allows us to use all of the remaining tissue externally to create a vulva and try to make also an aesthetic result. That seems to kind of be where our field is heading in terms of dealing with those challenging cases where there is a paucity of tissue to use, because there's just so little that's really been talked about or described. And as more suppression's coming through, like it's coming right at us. So as a field, like, we all kind of need to be aware and start thinking about how we can optimize these outcomes. And it's challenging because there's this question of how does that factor into consent when you're consenting someone for pubertal suppression? And then it's also hard to have that conversation with someone that maybe hasn't went through puberty or ever engaged in sexual activity. It's a really tricky thing. And when it comes time to actually do surgery, if an individual does go through suppression and ultimately is in their latter teenage years and wants a vaginoplasty, not only are you facing the struggle of not having a lot of tissue to work with, but that tissue hasn't been under the influence of testosterone, which definitely affects some things. And then a lot of patients, just from psychosocial issues and the dysphoria that they're experiencing, may have not had the opportunity to have a sexual partner. And more often than not, there's been almost no genital engagement in terms of self-stimulation or masturbation. So then trying to assess things like erogenous outcomes after a surgery when someone's never had an erogenous experience in their life is incredibly difficult because they don't really have a baseline to compare it to. Long term, we want people not only to have relief of dysphoria, but have like a functional and satisfactory great sex life too. And it's a very complicated issue, and I'm not sure there's like one answer for everybody, but I think definitely something that we're going to learn a lot more about in the next 5 to 10 years as we're doing just increasing numbers of these cases. And
what do puberty blockers do?
It means it completely blocks the production of your sex hormones. So obviously a man, you normally have lots of testosterone. You take puberty blockers, your testosterone falls to nothing, or almost nothing. Remember that this has never been licensed to treat gender dysphoria, so it's an off-label use of the drug. So there's never been any randomized clinical trial, and there's a lot of evidence that, particularly when it's begun early, that this leads to severe consequences down the line. For example, you create adults who can't orgasm, adults with no sexual desire. Because obviously, if you start at the very early stages of puberty, the child will never go through the normal process of sexual development that you go through in adolescence. Now that's a massive, severe consequence.
A child, in fact, will never be able to consent to this symptomatic treatment. Before puberty, a child has no understanding of the choice they are supposedly making when they choose to potentially never experience sexual pleasure, never have an orgasm, and especially never be able to have children, to give life to a child, whether as a father or a mother. Therefore, a child cannot decide not to have an orgasm and cannot decide to be sterile. An adolescent who has experienced sexual pleasure also cannot consent to never having children, to being sterile for life. And in any case, he doesn't realize he might no longer experience sexual pleasure because it's not clearly explained to him. So a child and an adolescent will never be able to consent.
The first generation of children placed on puberty blockers at Tanner stage 2, around ages 8 to 9, is now reaching adulthood. The boys have an almost perfect feminine passion, but they are sterile and anorgasmic. Can one be content with just being an image to be happy? One person recently killed his father and sister with a hammer. Nicky Secondino was well socially integrated and was starting a modeling career. Shortly before the tragedy, he expressed in a video interview his lack of sensation in the groin area. Unable to refer to his penis, he discusses it in a detached and impersonal manner, as if it were separate from his body.
It was useless, like it was just there to be there. And even as I really didn't go through puberty per se, but because I was on estrogen and stuff, but it never functioned the way something like that should function. I never felt the urge to explore that area or, go down that path. It just didn't feel right to me.
You want to grow up to be like them?
Mama says I might grow up to be the president.
Yeah? Mm-hmm. What would you change about the world if you were president?
Let trans people be free and go to the bathroom they want to go to.
The protocol for early sex reassignment in presumed trans children is based on a single Dutch study, the Dutch Protocol, whose findings have never been replicated. This study was funded by Ferring Laboratory, which is a leading company in the global synthetic hormone market. Ferring is the producer of gonapeptyl, a molecule that is similar to decapeptyl, which is a puberty blocker that is currently being sold in France. In this highly biased study, the treatment was given to a small group of 50 young adults who were already pubescent, carefully selected, without any control group. The effects were assessed over a few months without long-term monitoring. One participant in the study died due to these sex reassignment treatments, a death not accounted for in the final results. The Dutch protocol, filled with methodological biases, lacks scientific credibility. The phenomenon of transgender children is very recent. It is an iatrogenic condition entirely created by adults. It is growing exponentially. In France today, male adolescents are frequently undergoing breast removal surgeries in specialized clinics. Assembly line work resulting from an explosive social contagion and widespread adoption of the trans-affirmative model. Medical validation of anyone's gender identity is granted upon request, based solely on self-declaration. Children in distress are often led to believe their problems stem from a mismatch between their gender identity and biological sex. Many of these children have neurodevelopmental disorders or emerging psychiatric conditions. Others are victims of school bullying, sexual violence, or are coming to terms with being gay. All these struggling kids are being manipulated by activist adults, drugged into cognitive dissociation.
Over the past decade, there has been as high as a 4,000% increase in children being referred to so-called gender clinics across the United States. I was one of these children. My name is Chloe Cole, and I am an 18-year-old former transgender child. I transitioned from the age of 12 up until 16 when I realized it all was a lie.
Leading the English transactivist organization Mermaid, Susie Green has been a fervent advocate for early sex reassignment for minors.
I had a very sensitive, quite effeminate little boy who was probably gay. But Jack's dad did not approve of our child's effeminate behaviour. And it created such tensions that we ended up in couples counselling.
Rather than supporting her son to embrace his uniqueness and take pride in being gay, the chosen path was to view Jack as Jackie, a girl born in a boy's body.
7 years old, Jackie was referred to the Tavistock, which is the NHS clinic that supports children and young people with gender dysphoria, and received a diagnosis of gender dysphoria. Oh, really? Not a big surprise.
I think I was 5 years old when I said to my mother, like, God's made a mistake. I shouldn't, this isn't me, I'm wrong.
The transidentity movement contributes to conforming young homosexuals to a facade of heterosexuality through aggressive chemical and surgical means. Under Susie Green's leadership, Mermaid has become the world leader in promoting a trans-affirmative approach for kids exploring gender identity. The organization is under judicial investigation in the UK for providing children with dangerous treatments without informing the parents and for hiring 2 openly pedophile executives. Genevieve Gluck, co-founder of the media outlet Redox, along with her team, uncovered that a Mermaid administrator, Jacob Breslow, had been writing for a pro-pedophile blog for several years. He delivered a speech supporting pedophilia at a convention organized by the Association Before You Act, which aims to legalize sexual relationships between adults and minors. Darren Muse served as the digital marketing manager for Mermaid. This enthusiast of porn art drew trans children into unsecured parts of the web and did not hesitate to pose in overtly sexualized positions.
What do we want? Trans rights! When do we want them? Now!
Susie Green and her 2 employees were dismissed. Animals feel emotions. They gather based on connections, comfort one another, and mourn the loss of loved ones. The human species is now incapable of regulating its emotions, caught between increasing insensitivity and uncontrollable fits of rage. It is also the only species that allows the mentally ill and criminals to govern matter.
That if they do anything to actually keep law and order,
fuck you! 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 Hey! My choice! My choice! My choice! My choice! My choice!
Let me tell you something about LGBTQ rights, about trans rights. This is only going in one direction. You will respect us. You can be upset. You can be angry. You can think it's unfair. You can feel like we're stealing something from you. But it's still only going in one direction. You will respect us.
In May 2013, the DSM-5 reclassified transsexualism, replacing it with the concept of gender dysphoria in the American Classification of Mental Disorders. In May 2019, the WHO removed gender identity disorder from its list of mental disorders and introduced the concept of gender incongruence instead. Across Western countries, trans activists are actively lobbying to make it easier for individuals to receive reimbursement for sex reassignment treatments upon request. In France, being diagnosed with transgender identity grants full coverage of medical expenses under ILD 31, an off-list category typically reserved for severe and disabling conditions. Since 2022, no medical certificate is needed to obtain a diagnosis of gender dysphoria. Each year, the number of consultations for sex changes is growing rapidly, with candidates becoming increasingly younger. Puberty blockers for a few years, followed by opposite-sex hormones for life. Procedures may include mastectomy, breast implants, phalloplasty, metoidioplasty, hysterectomy, orchiectomy, vaginoplasty, sperm and egg preservation, various facial feminization surgeries, body feminization and masculinization surgeries, permanent hair removal, hair implants, and voice surgery. Each complete gender reassignment journey can generate hundreds of thousands of euros for professionals in the transgender industry. In the United States, these figures are 10 times higher. Leading doctors in France's trans industry refer to the authority of WPAF, the Global Union of Sex Reassignment Professionals. WPAF advocates for removing all age-related barriers to promote self-declaration of gender. It significantly expands the transgender umbrella with the idea of non-binary identity. The concept of non-binary identity makes medical services accessible to people who don't fit traditional gender stereotypes, even if they don't want to identify as the opposite gender. Interestingly, non-binary identities are thought to require as many surgical procedures as transgender identities. This includes breast augmentation for men, breast removal for women, and other unique procedures like nipple removal.
I don't know who needs to hear this, but top surgery is for anybody. There's no template for what you must look like after top surgery. What makes life so beautiful is the diversity in its people. And those who are post-op top surgery are no different. Top surgery isn't limited to one gender, one expression, one style. The only one thing that we all truly share is freedom.
We now have patients who claim to be animals, for example. I have a patient who claims that he is a dog, so I think to myself, okay, this is a continuation of these types of false beliefs. Because if you are biologically a boy, you are biologically a boy, and if you are a human being, you are not a dog. And so, in reality, we are actually validating a delusion. That is to say, it's a belief not based in reality. For instance, you have schizophrenics who think they are being pursued by the FBI. We know that is false and will never go along with it. We will go along with it to avoid disturbing them during the consultation, but also give them symptomatic treatment to stop this delusion. But strangely, for these children, we don't dare. We don't dare to tell them that it is not considered normal. We don't dare to tell them that it is a symptom of mental illness that needs to be treated. And so we go along with these types of symptoms and validate this delusion, which is obviously completely counterproductive. We are not going to help these patients, especially if they are young, because the important thing is to treat children and adolescents at a time when these beliefs are easily reversible. With the right therapy, and sometimes with the right temporary medication to assist, it is quite possible to help individuals reconcile with their human body when they believe they are a dog, or with their gender identity when they are transgender.
Due to the absence of safeguards in trans activism, surgeons have introduced the concept of sexual nullification, or nullo. This procedure involves removing all male genitalia, resulting in a groin as smooth as a Ken doll's. In its 8th set of recommendations issued in September 2022, WPAF now includes eunuch identity, male to eunuch, under the umbrella of gender identity. The World Organization of Trans-Industry Professionals advocates for the complete castration, removal of the penis, testicles, and scrotum of men identifying with an asexual gender. Among WPAF's members is Thomas W. Johnson, a professor emeritus in the anthropology department at the University of California. He persuaded the organization to expand the concept of gender identity to include those with a sadomasochistic fetish for emasculation. Thomas W. Johnson was rewarded by WPAF for significantly broadening the definition of transgender identity. To justify the inclusion of candidates for full castration in the Battalion of Transgender Identities, WPAF relies on a website known as the Eunuch Archives. This source serves as their primary reference point for validating such inclusions. Journalist Genevieve Gluck, co-founder of the Redox site, successfully accessed this site and reviewed its content. It contains nearly 3,000 documents of pedophilic fiction, with stories featuring fantasies of child rape, torture, and murder. In some narratives, prepubescent children are raped by doctors. In others, they are forcibly castrated during a sadistic sexual torture ritual. Redox reveals that for 2 decades, Thomas W. Johnson was an active member of this site under the pseudonym Jesus. Genevieve Gluck managed to identify 2 other academics involved in revising WPAF's standards of care. Richard J. Vassasug, an honorary professor at the University of British Columbia, went by the pseudonym Eunuchik for 2 decades, while Dr. Christer Hildal Villette chose the name Sister Christer.
Hey, this is Sister Christer with an important message for all of you boys and girls out there, all sexes. It's about cock condos. You know, these things, you know. I may not have much use for these things anymore, but you know, you gotta have a condominium for your cock. You gotta have a place to park it. You know, most of you boys spend a lot of time and effort and money making sure you're the best dressed boys in town. Well, when you're all done chasing around and whoring at the end of the night, you're heading home with your trek. You gotta make sure you got the best dressed penis in town.
Transgender individuals are gradually being challenged by non-binary and agender people, as the trend of eunuch men spreads online and globally. We don't need to learn the language of animals. To communicate with them, we just need to turn off the flow of mental ruminations and open ourselves to perceiving the real world. Alas, we are denatured animals, subjecting our children to the suffering inflicted on other species. The younger the children are when they transition, the more profit they bring to an industry whose revenue is skyrocketing, along with the rising demand.